How does Lynch syndrome increase pancreatic cancer risk? Imagine a family where multiple members develop different types of cancer at a younger age than usual. This pattern often hints at a genetic link, like Lynch syndrome. Lynch syndrome is a hereditary condition caused by mutations in genes responsible for fixing errors in DNA during cell division. These genes are called mismatch repair genes, and they include MLH1, MSH2, MSH6, and PMS2. When these genes are faulty, DNA errors pile up because the repair process doesn't work properly. This buildup of mistakes can lead to cells turning cancerous. People with Lynch syndrome are known to have a much higher chance of developing certain cancers, especially colorectal cancer. But research also shows they face an increased risk of pancreatic cancer. In fact, studies suggest that individuals with Lynch syndrome are about 7.5 to 11 times more likely to develop pancreatic cancer compared to the general population. By age 70, about 3.7% of Lynch syndrome carriers may develop pancreatic cancer, which is significantly higher than the less than 1% risk in people without the syndrome. The reason for this increased risk lies in the defective DNA repair system. When the mismatch repair genes don't function properly, errors in the DNA of pancreatic cells can accumulate over time. These genetic mistakes can cause cells to grow uncontrollably, leading to cancer. Interestingly, pancreatic tumors in people with Lynch syndrome often have unique features, like a medullary appearance and a lot of immune cells called lymphocytes infiltrating the tumor, which reflected the underlying genetic problem. Family history plays a crucial role here. If a person has Lynch syndrome and a close relative with pancreatic cancer, their risk is even higher. That's why doctors often recommend screening for pancreatic cancer in Lynch syndrome carriers who also have a family history of the disease. This screening might involve magnetic resonance imaging or endoscopic ultrasound every 1 to 2 years to catch early signs of cancer or precancerous changes. In summary, Lynch syndrome increases pancreatic cancer risk because of inherited mutations in genes that normally repair DNA errors. When these repair systems fail, genetic instability occurs, leading to earlier and more frequent pancreatic cancers in affected families. Knowing your family history and undergoing genetic testing can help identify those at higher risk and guide appropriate screening. Always remember, if you have concerns about your risk, consulting a healthcare professional is the best step to take for personalized advice and management.